And also press record. Yeah, perfect. So we'll just wait for people to filter in. Normally takes a few moments. Welcome, everyone. Thanks for joining us. We're going to get started in just a few moments. I just want to wait for a few others to filter into the room. We're already around 40 people, so that's fantastic, but people are still coming in. So if you just give us one moment and then we'll get started. Thank you. Okay, good afternoon, everyone, or good morning, depending on where you're joining from. Thank you so much for joining us for this side event today. My name's Jamie Bridge. I'm the chair of the Vienna NGO Committee on Drugs. Every year, we work with the UNODC Civil Society Unit to deliver a side event at the Commission on Narcotic Drugs. And when we were planning for this year and thinking about what topic could we cover, there was no competition. You know, the only topic really to discuss from the last 12 months is the COVID pandemic, and crucially to also talk about the impact that it's had on our work as civil society. All of us have been impacted by this pandemic. I don't think that's any surprise for you to hear. And today we're going to hear from UNODC and from Jean-Luc, but also from some civil society speakers from all around the world who can tell us their first-hand experience of how COVID affected their work and what they've done in response to the pandemic, and to adapt, crucially, to adapt to the pandemic as well. For those who may not have seen, the Commission on Narcotic Drugs on its opening morning on Monday have adopted a new statement relating to COVID-19 and the impact that it has on drugs. And that statement acknowledges the role that civil society has played in the response, and we thank member states for that acknowledgement. I would encourage you to have a look at that statement. I'll even try and put the link in the chat for people to see when I get a moment. But just to say that obviously this has been a key topic at this commission. And will continue to be. Obviously, the pandemic is far from over. But today we really want to focus in on the civil society experiences over the last 12 months. And I'm hoping that we after our speakers have had their interventions, we should have enough time as well for some questions and answers. So there hopefully will be an opportunity for inputs from all of you as well. Just a few housekeeping things just before we start. The session is being recorded. That's to enable people to view this if they can't join us live because of time zones or because of competing priorities. So the event is being recorded right now. And we also have translation. So thank you so much to our translators. We have French, Spanish, and Russian translation available. So on Zoom, if you look at the bottom of your screen, hopefully on Zoom, you should see an option to choose your interpretation channel. And you can select one of those languages and you should be able to hear the translation live. If you have any problems, please let us know in the chat and myself and Sarah can try to help. If you're hearing too many voices at once, one option is that you can, in that interpretation option, you can mute the original audio, and that might help to make it clearer for you. So please try that. And like I said, if you have any problems, just let us know. I think that's all from my side. So I don't want to take up any more time. I want to give the floor now to Jean-Luc from UNODC. Thank you so much for joining us today, Jean-Luc. And Jean-Luc's the director of the Division for Policy Affairs at UNODC and a long-term ally of the Vienna NGO Committee and the work that we do. So thank you again, Jean-Luc, for joining us, and the floor is yours.
Thank you very much, Jamie, and a real pleasure to be here with you on this side event. I hope you capture me well. If not, let me know. But yeah, well, what can we say? If you have a topic on the pandemic, what better than to welcome you all in the virtual mode. The event, as Jamie tells, will showcase some practical examples of the NGOs upholding health, other important services during this time of crisis, and this by organizations across the globe. I saw in the chat that we have people from Burundi, from Florida, the US, from France, all connected here. So good morning, good afternoon, good evening. We all definitely will hope that this pandemic will be behind us soon, but still up to today, we find ourselves in a very precarious situation. And no doubt the COVID-19 has had an impact on all of us as individuals, as staff members within organizations, be they civil society, private, public, or whatsoever. But the effect on the especially vulnerable has been especially dire. And for civil society organizations caring for these at risk, the last year has been extremely demanding, beyond the fact that the standard physical outreach, which you normally would roll out, became near impossible. Even if the pandemic were tomorrow behind us, we will be left with thousands, hundreds of thousands, millions, socioeconomically damaged, and as well with a mental health crisis we do not even fully comprehend today. The implications for those caring, such as you, the civil society organizations, will be enormous. And this only already indicates that we can turn the page on the pandemic, leaving alone the fact that we're still having to suffer its consequence today. Your work already was before the pandemic, is during the pandemic, and will be even more crucial and essential post-pandemic. Take access to controlled substances for medical purposes, with hospitals overwhelmed by COVID cases. Many regretfully, also loved ones, passed away without receiving the necessary care, while other patients had to postpone treatment for life-threatening diseases and continue their suffering alone at home. In the first half of 2020, many countries reported drug shortages at the retail level. In too many countries with little or no access to controlled medicines, patients were unable, even more so, to receive medications for pain management. The current civil society responses often went beyond upholding existing services, and many found innovative ways, new ways to act during the pandemic. And I hope that indeed during this side event, we will, touching on very different aspects of COVID-19, hear those responses, ranging from access to controlled medicines, to prevention and treatment services, to alternative development. So as in UNODC, we also had to gear up, despite the fact that multiple of our field offices had to temporarily close or were hampered in their operational work due to the lockdowns. In fact, our implementation rates fell down by about 1/5, 20%, implying that many of our beneficiaries we're used to deal with do currently not benefit from our technical assistance, or only in a reduced manner. To support our field outreach, we immediately reacted to the pandemic with research briefs, giving an analysis on the changing crime patterns, the new challenges focused on the pandemic, with guidance on treatment, care, and rehabilitation of people with drug use disorders. For example, related to HIV prevention among people who use drugs and people in prisons, and how COVID-19 affected them. As many among you will sympathize with, the pandemic kept children at home and put families very much under stress. We as UNODC provided materials in more than 40 languages to support these parents in those difficult, challenging situations. Within the large UN system, the rubber had to hit the road hard and fast, and the pilot UN reform, which was instigated before the pandemic, was prematurely and severely tested. Health evidently was the first immediate concern, and WHO, the World Health Organization, rolled out its strategic preparedness and response plan on February 24th last year, so nearly immediately after the breakout of the pandemic. The humanitarian concerns were replied to in May 2020 with the Global Humanitarian Response Plan led by OCHA, and as a third final part, the UN framework for the immediate socio-economic response to COVID-19 came on stream in April 2020. So relatively fast, and luckily that we had the architecture of the UN reform plan before the pandemic so that we could indeed roll that all out in little time. Now, the discussions with the UN do currently not center on how we can rebuild the pre-pandemic situation, but how we can rebuild better, fairer, more equitable, and more sustainable. Today's meeting is not about the UN, but about you, the civil society, and I'm very eager to learn how you, in the many facets and colors you do operate, have been responding to this extreme challenging environment. Hence, my thanks for inviting you, thanks to the Vienna NGO committee, and to call in this side event, which I have no doubt will be very interesting. Over to you, Jamie. Thank you very much.
Thank you so much, Jean-Luc, for those remarks. And yeah, I think that perfectly frames what we're going to discuss for the rest of this event. So without further ado, I'd love to give the floor to our first speaker. It's Dr. Catherine Pettus. Catherine has submitted a video in advance because it's very early in the morning in her part of the world. So Sarah, if you can display the video now, and then I believe Catherine's colleague, Heloisa, is with us in case there's any questions at the end of the session. So Sarah, over to you if you're able to play the video. Thank you very much.
So greetings, everyone. I'm going to talk about access to controlled medicines 60 years on, since this is the anniversary, in the context of this civil society and COVID-19 side event. So thanks to VNGOC. I'm Catherine Pettus, Advocacy Officer for IHPC. I'm going to tell you a few things about IHPC before getting into the meat of the topic, just because I want to say that we're a global membership organization of palliative care practitioners. We have members in all regions and country income levels. Our vision is a world free from health-related suffering. This entails access to palliative care as a human right, and it also entails access to internationally controlled essential medicines. Those are the medications on the WHO model list and on the schedules of the International Drug Control Conventions. So they have this double availability mandate as well as control mandate because they are supposed to be vectors of addiction. And then we are also a non-state actor in official relations with the World Health Organization, an NGO in consultative status with ECOSOC, which is why we can participate at CND. And we're a very proud member of the Vienna NGO Committee on Drugs. So in regards to COVID issues on controlled meds, and I have to whiz through this in 5 minutes, but there are supply chain blockages, which are actually being addressed at a parallel side event right now, a high-level side event on controlled meds. There was another one yesterday morning on this topic, hosted by Switzerland. And on top of already fragile health systems, with very low or no access to controlled medicines, these have been stressed for palliative care and COVID patients because they need, in many cases, the same medicines, which are morphine and midazolam, which is a paralytic, and both these are in severe shortages or stockouts in most health systems. Meaning that practitioners are using expired medicines, even if they're available. They're intubating without sedation if patients actually get to the hospital in the ICU, and only midazolam, which is the paralytic, is available. So in other words, as the picture shows, you're sticking this plastic tube down someone and they're not sedated. They're paralyzed but completely conscious. And this is a form of torture. This is being reported from Mexico and other countries. So we're getting innovative ground level responses from our membership. Many are resorting, because of the transportation issues, to telemedicine and electronic prescribing. In many cases, they've simplified, as the INCB has specified, the import and export licensing, and in many cases they're not, and their supply chain issues cannot just be overcome so easily. But there are local networks which are stepping up, including in some Brazilian cities, the cartels, the people who run the illicit networks, are making sure that patients get controlled medicines in their neighborhoods. And my source for that is your new deputy treasurer. And in Uganda, we've been told the bodabodas, the motorcycle taxis, are taking controlled medicines to patients because public transport's been shut down and many private cars are not allowed on the road. And of course, new partnerships between civil society, government, academia, and the private sector. So new, very synergistic types of collaborations, and we're getting that from Colombia. So these are just a few of the innovative ground level responses, but mostly the situation is dire in terms of access. The way forward that we're plotting is to change the narrative, of course. This is what we've been saying for years, that medical opioids are not vectors of addiction and death. This is contrary to the American narrative, which says that there's going to be a global opioid crisis as soon as you put more opioids in the system, because that's what's happening in the US. That is not necessarily the case. Systems failures underlie both the US situation and the global crisis of access, and as such, systems fixes can be made available, particularly if you increase the participation of global civil society. So that's why we're stepping up our participation in global civil society meetings and multilateral meetings. We're training a shadow diplomatic corps of our advocacy focal points in different countries, and we're publishing and sharing research, like this article which just came out a couple of weeks ago here on the impact of COVID on palliative care workers around the world, and I've reported some of those results to you. So thanks so much to the VNGOC for inviting me, because it's organization like this that are going to strengthen civil society participation around the world and displace some of this false narrative around things like access to medicines being something which could cause a problem, because it doesn't have to be, with proper regulations and participation. And congratulations to the new board, particularly Heloisa Bargiato for the IHPC, because she is going to make sure that controlled medicines are on the agenda from now on, as Jamie has made sure also. Here are just a few suggestions for further reading. You can go to our website, hospicecare.com, and thank you very much. I know I'm already over time.
Thank you so much, Catherine, for submitting that video. It worked really well. I really appreciate it. That video, obviously the video from this whole event will be available on the VNGOC website, but we will also make sure that slides are available. So all of those links that Catherine has very kindly shared with us will also be at your disposal as well. So thank you very much. As I said, we'll save questions until the end. So what I'd like to do now is give the floor to Omar. Omar, you're there? Yep, fantastic. Thank you very much. So Omar is from the Moroccan Green Crescent and is going to be talking about the work that has been happening in Morocco to provide prevention and treatment services in the time of COVID. So Omar, the floor is yours. Thank you so much.
Great, thank you, Jamie. Good morning, good afternoon, good evening, everyone, depending where you are. This is Omar speaking. I'm the Vice President of the Moroccan Green Crescent, and I'm here to share with you the experience of the Moroccan Green Crescent during the COVID-19 pandemic. So basically, as you all know, the pandemic impacted and had big impact on local NGOs everywhere in the world, the proximity work we used to have is all impacted, and we have to adapt our way of supporting addicts and their families. So the Moroccan Green Crescent launched last March a special program for addicts and their families to support them overcoming the challenges imposed by the pandemic. So the idea is creating a listening unit composed of psychiatrists, of psychologists, of doctors, of addictologists, of coaches, of lawyers who are able to be simply contacted by addicts or by their families to provide the support they need. So we basically prepared the list of the members of the unit and shared it on our Facebook page, on the Facebook page of the Moroccan Green Crescent. And through this list, we have received until now over 919 calls from addicts and their families. Mainly, and 70% actually of these calls were received from the families from the relatives of the addicts seeking for answers, seeking for questions, for advice to see mainly how they can convince their addicted relative to accept treatment, to stop addiction, to visit a doctor. So we were contacted mainly through phone calls, through WhatsApp calls, and more importantly, through WhatsApp messages. And most of the calls, most of the people who contacted us, they needed someone who can listen to them, someone who can give a proper advice, someone who can propose treatment, but of course, tele-treatment for the time being. So out of the 919 calls we received up to now, as I said, 70% were the addicted relatives and not the addicted themselves. So only 270 addicts actually contacted us. And out of these 270 addicts, 10% were able to physically visit our offices, and 10% were able to receive treatment for addiction. So until now, we can say that around 20 addicts successfully stopped addiction starting since last March. And when we talk about addiction, we talk about a various number of substances. We talk about cannabis, we talk about alcohol, we talk about cigarettes, we talk about cocaine, we talk about benzo, about Rivotril. So it's really a wide number of substances used here. And the idea is to remotely provide this support to the addicts, to the addicts and to their families who actually suffer from a big impact because of the COVID-19 pandemic. So as a local NGO, our objective, or what we are trying to work on, is to further develop this initiative. So initially we thought that this initiative was going to be temporarily because the lockdown and all the restrictions and the pandemic is going to be temporarily, but as you see, it is not. And now over a year ago, and we are still facing the restrictions imposed by the pandemic. So this initiative is actually still going on. Initially, we thought it would be for maybe 2 or 3 months, but until now it's over a year, and it's a successful initiative. We are happy to say that, but of course, we hope that the pandemic will be over soon and we will resume back our life. But meanwhile, there are people who need support. There are people and addicts and their families who need support. So we are still providing this support through this listening unit. And what we are trying to work on now is to develop a digital platform to have an easier communication between the addicts and the team members of this unit. And of course, we need more resources. We need a lot of things to be able to develop this initiative and this digital platform. But the purpose of my experience sharing today is to say that even with limited resources, local NGOs can actually help with alternative solutions, not necessarily with big resources, but with the limited resources, simply having a Facebook page, having a list of doctors that can be reached during a specific time. We we actually indicated the specialty of each member of the unit with the working hours they can be contracted at. And with these very basic tools, I mean, we were able to actually reach over 900 cases and successfully treat over 20 patients and addicts. So what I want to say today is that with limited resources, we can work. The pandemic should not be a challenge that will stop us. Of course, it's a challenge, but that can be overcome. And I will be more than happy to communicate later on if there are any questions. Thank you very much, Jamie. Thank you, everyone, for listening.
Omar, fantastic. Thank you so much. It's such a, when we received your abstract when you applied to speak, we were so happy to see it because it's such a wonderful, practical, easy implement, easy thing to adapt. And so you were so quick to adapt as well, because as you said, people still need that support. That hasn't gone away. If anything, people probably need more support than they did before the pandemic. So really, really great example. And thank you, Omar, for submitting that and for speaking today. Okay, so again, I want to get straight on to our next speaker so we can hear as many perspectives as possible. We're going to go slightly out of the order that we were originally planning. So I'd love to now give the floor, if I can, to Rogers from Uganda, who can give us the experience from his organization in Uganda. Rogers, thank you for joining us. We are also hoping that Rita from Kenya and Alberto from Peru will join us, but then as far as I can see, they're not on the call at the moment. So if either Rita or Alberto, if you are there and maybe you've logged in under someone else's name, please let us know. But for now, Rogers, the floor is yours. Thank you so much for joining us.
Thank you so much, Jamie. Thank you so much, colleagues and the VNGOC committee who have made this happen. We know this has been, it's been quite a trying time for us to be able to organize this event, but I think what we are doing here is very good. Thank you so much. Thank you. I'm going to just take you through what we've been able to do as an organization in terms of responding to COVID-19. What are the responses? What did we manage to do? I don't know if Sarah was meant to share my presentation.
Yes, just give me a second and you'll see it on the screen hopefully soon.
Okay.
Thanks, Sarah.
Okay.
Yeah, that works. Perfect.
Thank you. Yeah. Thank you.
Do you want to make it full screen, Sarah?
Yes.
Yeah, perfect. That's it. Thank you. Over to you, Rogers.
Okay, no worry. You can move to the second slide, sir. Okay, just to highlight some of the key salient issues. Just like in other parts of the world, COVID-19 had some devastating effects, especially the young people that we serve and work with here in the organization, in Uganda Youth Development Link. But the challenge is that when the lockdown measures came, that over 2,000 slum youth and the poor children whom we are serving as an organization scattered. I mean, some of you managed to go to their homes, but some of them are homeless, some of them don't have shelter. So there was that kind of uncertainty which they experienced at the time. But we also observed that when you look at the orphans, especially the orphans who did have in the safe shelter, really, they are unaccompanied, and the youth who are experiencing homelessness, we are the worst hit by the pandemic because sometimes we as civil society organizations that are there to support them, to serve them, to give them the necessary support. If we're not available and we can't support them in any way, they're also a little bit curtailed in so many cases. We also see increases in cases of sexual exploitation of children. And this was basically done because we wanted looking means of survival, but also to be able to meet their basic needs. But also sometimes, the girl child, especially sanitary towels, those were challenges. But also, we also observed that children who had been rehabilitated and the process of recovery, we are more or less on the verge of relapsing and going back to other illicit activities, which we thought that this was really quite a major issue as far as we are concerned. Next slide, please. Okay. Some of the challenges here we note in terms of some of the young urban entrepreneurs, the employees and savings group. One of the challenges, of course, the restricted movements, and therefore they couldn't market their goods. And some of the young people who are working with the perishable goods had had so many challenges in terms of their goods not being sold and perishable. There are also issues of depression and anxiety, stress and trauma, especially among the urban youth, because one, there are those who didn't afford to pay rent with the places where they were working from, but also many of them lost their economic means of survival. As I also note, there are some of them defaulted on loan payments, because we know there's some young people who are getting some soft loans from different microfinance institutions. They are defaulting on loans, and when default on loan, there are challenges and consequences that go with that in terms of loan recovery for the financial institutions. Even those who are looking for employment, they really had challenges. I mean, there was no work for them to be done, to do, because we are again downsizing. Eventually, we are downsizing their staff. And so many of them, especially those working in hotels and restaurants, and so have been quite affected by this. But of course, so many of them have been laid off from work, which we think that quite affected them as quite a big challenge. Next slide, please. Okay. Yes, the other one we can talk about is, of course, the other challenges. Of course, I've talked about anxiety. We talk about lack of government commitment to support or offer recovery plans, especially for the urban youth and urban children who are in informal employment. But also, how do we support them to get back to work? How can they get back their businesses? Because the business had collapsed. So, but there's that lack of informal support from government, but even from the different entities that are supposed to support them, so they can be able to get back to work. And that was quite a challenge for them. But also the prices of goods and services were increasing, and even taxes, they still had to continue paying taxes, which are part of the obligations. But you can understand, if someone has been through lockdown, has not been working, has not been earning, you cannot ask that person again to pay taxes, as much as they're doing informal business. So I think they need to give them some bit of recovery plan for them to be able to start up fresh. Next slide. Okay, so in terms of response to the COVID-19 pandemic, as an organization, we were able to reach out to well-wishers, to donors, to foundations, and they're able to support us in various ways. And this is how we supported the young people, especially those who are affected by COVID-19 lockdown. One, we provided food relief and support, especially, of course, in terms of maize. We had rice, we had beans, because most families and households don't have anything to eat. But even the food that the government distributed, some families were not able to get the food. And even it was one-off. So at least we were able to supplement, we were able to provide food, especially to the households, the children whom we are serving. We also look at the issues of emergency cash transfers. We are also affected. We gave some emergency cash transfers to these households, to some of the families that we are working with. So they're able to purchase some basic food and some basic services, and also to look after their families, because this is a time of crisis, and so they needed out of our support. We provided personal protective gears, especially when we look at artisanal masks, look at sanitizers for the youth. We look at also the personal hygiene items such as soap, wash facilities at the drop-in centers, and even wash facilities at their households, because we felt that this is one way that we could really be able to support the households. The other thing is that we also provided sanitary towels, especially for the adolescents, for the adolescent girls. We also partnered, especially with the government, in terms of food, in terms of distribution of food items and food relief to the communities we are working with, and by providing vehicles, providing support in terms of transport, because that was the government really had a challenge in terms of transport. So we provided, as an organization, provided transport so that the food that was being distributed can go to the most vulnerable poor within the urban slum communities. But we also supported a lot of so many young girls. I think over 1,000 young, through psychosocial and online virtual mentoring sessions, because this being a time of crisis, and the girls, we didn't want them, even the boys, to feel that they are not wanted, that they had been left out alone. So we activated a system of doing some virtual mentoring sessions with them through phone calls. Social workers, we are calling them to give them support, because we already have contacts of the caregivers of these children. So we are calling them directly, talking to them, counseling them, but also talking about issues of COVID-19. How should they keep safe? Because the issue of keeping safe marriage issues, how can they avoid sexual exploitation in their own environment, despite the catastrophe they are going through. We have also highlighted that as an organization, we also provided one of our safe spaces in Banda, one of our safe spaces to support in terms of training cadres and support the distribution of food items for the communities where we are serving. Can you go through the next slides quickly? Those will be.
Thank you, both.
Yeah.
Just 1 minute left, if that's okay. Thank you.
Okay, fine. Yeah, I'm just winding up. This is just basically a picture just to show you the kind of work that we're able to provide and we're able to provide to the different communities, providing protective equipment and materials. You can see we have soap, we have sanitizers, we have face masks, supporting government distribution of food in the different communities, working with the Red Cross, but also working with government institutions. Okay. Yes, yeah, I've talked about provision of food items and rations. You can move forward. But also community sensitizations, especially when it comes to surveillance and also supporting the different beneficiaries with cash transfers, because those have been very instrumental and very helpful. You can move quickly. So, but I think as I wind up, I think the issues that one of the issues that we see that we are learning, one of the issues, emergency response plans are important for organizations to put in place in terms of mitigating risks which can happen, like COVID-19. Cash transfers need to be emphasized to support families, but also we need to strengthen the culture of saving and also supporting the youth communities in the way we work, but also building social capital in terms of family bonding, family attachments, working with peer educators, working with different people in the communities that we are serving. Last slide. Last one, I would like to really wish to acknowledge and appreciate the support that we got from the Rapid Response Fund, from Trade Zone Netherlands, from Plan International, Denmark and Uganda Country Office, Oak Foundation, Lutheran World Federation and Bed for the World, LGBT Movement, and also Professor Mary Jane, who supported our efforts at the time of crisis. We are really indebted to them. So thank you so much for listening to me. I'll be here, I'll be available to be able to answer any questions that may arise. Thank you.
Rogers, thank you so much. And it's great to see, because we spend so long at CND talking about the work that civil society does on the ground, and you've just given us another really good example of that. So thank you. Okay, so we do now have Rita Musa, who's the founder of AHF in Nigeria. So Rita, I'm happy to give the floor over to you. Thank you for joining us. And I don't know, Sarah, do you have the slides that we can share for Rita? I don't know if they came through in enough time.
I have them. I'm just gonna share them. Just give me a second to set it up.
Okay, no worries. So Rita, if you just want to start, just start, and then Sarah will upload the slides as soon as she's able to. So the floor's yours. If you just want to unmute and then tell us your experience. Thank you. Can you unmute?
Yeah, yes. Perfect. Hello, everyone. I hope I'm being heard. Can you hear me?
Yes, I can hear you perfectly. Thank you. And I think we can see the slides now as well. So that's great. So over to you, Rita.
Okay. All right. Hello, everyone. And thank you very much for the opportunity to present a little on the side effects on this side event, the CND Side Event. I'm going to give a little brief on some of the responses we had during the COVID-19 here in Nigeria. I'm just going to direct it to one aspect of Nigeria, because Nigeria is actually big. So most of our interventions were in different areas, but one of the areas that gave us a lot of difficulties. So this is, next slide, we have our Tommy Massa Health Foundation. It's a product of the desire to see an increased productivity in the society through the provision of access to non-discriminatory healthcare and health advocacy to vulnerable people, especially female who use drugs. Now, the slides are there. We have female who use drugs, adolescent young persons infected and affected by HIV, drug use, negative social influence. The pandemic, however, broadened our reach. During the pandemic, we could not just focus or continue with our exact target because the whole world was in a rupture in a way. So with funds from partners like Frontline AIDS, through pitch partners, we had Drug Harm Reduction Advocacy Network also giving sponsorship. We had the Nigerian COVID task force that was set up by the Federal Ministry of Health, who also brought in some PPE materials for assistance. Tami Masa, the foundation itself was able to provide minimal resources for people in the most affected area. Now, in deciding where these interventions are most needed, we made inquiries and then followed the news to identify the needs of 3 local governments in the northwest area in Nigeria. Now, those local governments we are listed here. I have Kajuru, Kachia, and Kafanchan local governments. Next slide, please. Because of the COVID pandemic, a lot of people were decapitated in resources, and then community members were also, there was a lot of low life expectation, a lot of unplanned situations. A lot of people were found stranded and in several situations that needed help. But most especially in these 3 local governments we identified, we had cases of the Herdsmen attack. These are a group of terrorists that attacked specific local governments in the northwest as at that area. That was around April to September. They come in at night and then they kill families, and a lot of people lost their lives. A lot of people were displaced from their homes. Now, because of these insecurities, most people, and then the lockdown came in, there was no movement. So lots of people were displaced. They couldn't be in their own residential places because of the fear of the attacks. And then they had to move to a more crowded area where they feel more secured or more safe. So because of this, some schools and hospitals, churches, mosques around those areas were able to provide their grounds for safety as a temporary camp for those people who were affected. But as time goes on, the killings continue. So more people relocated to those temporary centers, and then the crowd was too much, and the situation kept getting worse, and we had to go there. Lots of other organizations had to access the camps for support. Some provided food packages. Any provision you could make at that point was actually very much welcome. So there was a high report of sexual harassment during that period in the camp, because there were young girls everywhere, there were adults, and then the lifestyle, the way they were all packed up in the same place. So many things led to another, and then so some of these reports got to CSOs around the community, and these were part of the reasons why our attention was brought in to assist in these areas. Next slide. Okay, our response to COVID-19 pandemic during the herdsmen killing in northern Nigeria, Kaduna State. That's what we call it, the herdsmen killing. The local governments were identified were places with reports of unrest, insecurities, and high death rates from the herdsmen attack. Now, Altami Masa Health Foundation assessed these areas with the help of the state's local security agents. There were COVID-19 task forces that were set up. Though movement was restricted, we had to go through the state government task force to assess those camps for our own security, and then also be able to assess the camps, because the camps were also protected with police task forces around. So to provide minimal survival packages and COVID-19 interventions to those living in the camp, we had to go through the security agents. Now, the organization team set out initially. The funding we had, as Altami Masa is mainly focused on helping women who use drugs, adolescents. Our target area were not necessarily COVID-19. That is the summary of it. So, but the organization we had to provide for COVID assistance, and not necessarily its target populations. We set out initially to meet up with the needs of our women who use drugs in the communities. But unfortunately, with the whole crisis, the pandemic, and then the situations we saw at the camps, we had to enlarge or increase our reach. The next slide, please. So, and the problems we identified in these local governments, we found out that first, there was unavailability of mechanisms and supports for the provision of personal protective equipment, as PPE. Um, yes, including there were no gloves, there were no masks, the camp was just populated and people were just living in an unkept area, just scared of, just there for their safety. Now, there was also poor response time by hospitals and health workers to COVID emergency. Now, the pandemic was ongoing, and then the fear of the herdsmen was still ongoing. So when any case is found, when there are similarities or COVID concerns in the camp, the response time was very little. So what Altami Masa did was we tried to donate, per se, some of our vehicles to accommodate or move people to COVID areas that were for treatment and for care. Those areas, those sites that were dedicated especially for COVID persons, people who were found or suspected to be with COVID-19. So another problem we found that there was high reliance on international multi-donors, and response was very low from domestic resources. A lot of the government, the Nigerian government was yet to play a very major role during that period. That's around April to September, about September 2019, up until I think beginning 2020, when we started getting a little more assistance from international donors and so. So there was also lack of regular COVID-19 prevention education. There was nobody telling them you need this physical distance. Nobody was telling this this group of people you need to wash your hands, you need to sanitize, you need to try to avoid crowd and everything. So that was lacking. That was a problem. And then the dependence on traditional healing methods. A lot of people there just believed that since they say COVID-19 was more like the cold, the normal cold people go through, you could easily just mix a few things they are used to and then take it and then you're fine. And others would bring up some traditional things and so. And then we also had people relying on religious beliefs, like believing maybe a miracle will happen or so. A whole lot of things were going on in the camp, and then the overpopulation was another big thing. Next slide.
Thanks, Rita. Just like half a minute left, if that's okay. Thank you, Rita.
Okay, I'll be fast. So some of the methods we adopted to prevent or reduce the spread of COVID-19 in those camps, we had to set up a COVID-19 stop shops because we couldn't expose our staff to those camps directly. We had to use set up accommodations very close to the camp where we could easily drop something in between with a distance, and then they could come one after the other to pick what we have for them. So we had those, and then we brought in a little PPE, some nose masks and sanitary pads for the ladies, and then we had soaps. We had minimal funds that were given to us by our sponsors. Also, I think I skipped that part. We also partnered with Rotary International. They also sponsored us on some of the supplies and some of the funds as well. And we also introduced washing hand posts in the camps and disposals places where they could easily drop off their used tissues or used towels and so. Also, we also made linkages to treatment centers. Now, the linkage we had was we provide what I said earlier about providing our vehicles to transport people who were suspected with COVID-19 cases to the hospital. We also had an in-house doctor that comes in, not an in-house health personnel that was around to always dictate the symptoms and then help respond and then link us directly to the clinic, the centers that were made specifically for COVID-19. Then we have the COVID-19 education as well. I'm sorry, next slide, I'll make it fast. Okay, I think that's it. Challenge is that it's just with the overpopulation was something we couldn't do anything about that because we just encouraged that they use more space. The camps were separated a bit more and that, and then we tried also to get them to keep their environments clean. We tried also to get sachet water to them in the camps, and then a little food supplies in packages, and then medical supplies we could only link them up to where they could get them now. Thank you very much.
Thank you so much, Rita. I am sorry to rush you. I was happy to allow people a bit of extra time to speak because one of our speakers hadn't joined us, but I now see Alberto, that you've managed to join us at the last minute, which is fantastic. So what I'd like to do is ask for your patience to the participants, because I know a lot of you have got other meetings to go to, and certainly Jean-Luc, I fully appreciate if you need to leave us for other meetings, and thanks again for joining us. But maybe Alberto, now that we have you all the way from Peru, and thank you so much for joining, maybe we could give you the floor now, Alberto, just for a short intervention. If you could maybe go through your intervention, but maybe just a few minutes if that's possible, because we're already slightly over time. But thank you so much for joining.
Thank you. Thank you very much, Jamie, and my apologies for the delay. I made a big mistake on the calculation of difference of time between Lima and Vienna, and that is the reason, because I'm late. My presentation is very short, really. So if we can go over, I believe we can do it in a very few minutes.
Sarah, are you able to share the slides?
Yes, please.
Yes, do you want me to share the slides, Alberto, or will you?
Yeah, please, if you can do it, I will appreciate it.
Okay.
Just give me a second, please.
Thanks, Sarah. But Alberto, you start anyway, and then we'll get the slides up as soon as we can.
Okay. Thank you. Well, coming from almost 40 years and working on drug control, it's a pleasure to be here. From the side of the civil society, my previous experience has been all in the government side. We from CEDRO in Peru, we appreciate very much the invitation of the VNGOC, as well the UNODC civil society unit to participate in this event. As we will talk about articulation from the civil society with the other entities facing the pandemic. So please, the next slide, please, Sarah. Yes, as I said, CEDRO, which is perhaps the most recognized NGO in Peru that has been working since in the field of drug control abuse, has been working since 30 years ago, basically promoting health, prevent the abuse of drugs, and attack the chain of drug production and trafficking. Basically, CEDRO has works on the education and information side. However, now is evolving towards a more holistic vision that encompasses other issues like digitalization, financial education, and other programs. Since we work basically on the Amazonia side, where the coca fields are in the highlands of the Peruvian jungle, as soon as the pandemic came to Peru or arrived to Peru, immediately adapt to help and to support the alternative development communities affected, as well the Amazon native community affected also. The next one, please. A very fast context, we have more than 1.6 million cases here in Peru, already passed the 25,000 people dead, and the impact of the pandemic in the Peruvian economy has been a disaster, really. The government has been overwhelming in its capacity and is not able to provide sufficient support to the population to the face of the pandemic. And the authorities at the whole levels, government, central government, regional government, and local government, have requested the support of civil society to help them in facing the pandemic. The next, please. Well, this is a very it's a slide that shows where the project that we are talking about, that we call Alianza por la Amazonía Frente al COVID. It's an alliance for the Amazonia to face the COVID-19. As you see, we work in the dark green area, which is basically the Peruvian jungle. The next, please. This project, which basically tries to contribute to mitigate the health, social and economic impacts of the COVID-19 on the vulnerable population in alternative development fields and the Amazon Native community, has three main components. The first one has to do with information to sensitize the largest population about the COVID-19 and promoting habits in the prevention of the disease and promotion of comprehensive health. The second one is to build resilience capacities and personal and community coping strategies in the face of the psychosocial impacts of the pandemic. And the third one is to promote the economic recovery of the targeted population. As you can see in the slide, there are several ways in which we address these goals through a communication strategy, guidance and psychological counseling, promotion of mental health, capacity building and promotion of care, as well as financial education, promotion of business, small business basically, and access to financial products and services. The next one, please.
Thanks, Alberto. Maybe just 1 minute left, if that's okay. Thank you so much.
Yeah, this is the last one.
Okay.
So in doing all these, articulation is key. Without articulation, it is not possible. So the reason because the government has called us to help them in this project is because we can articulate from the bottom, so from the communities themselves, with several level of governments, from the small one to the big one. That means that we work with the governments and the different entities of the governments at the local level, that is municipality and district level, as well as the regional level, that could be similar to a state in the case of federal countries, and the national government. Articulating with the ministries of health, education, culture, because here in Peru, culture has to deal with the native population, and at the same time articulating very closely with other NGOs and the private sector, which both are key, very important. Their support is really important in this endeavor. So that is basically what I want to mention. Again, I'm very sorry for the delay, and thank you very much for your attention.
Alberto, I really, really appreciate you joining us. I know it's incredibly early for you as well over there, and I'm really glad you did, because that's what you've just presented there really kind of helps to provide this scope of the different work that civil society does across different sectors. And with our speakers today, we've heard from a range of, a lot of different kinds of work that civil society has been doing during this pandemic and in response to this pandemic. So, like I say, I'm really glad you could join us, Alberto, and thank you very much. It's almost 10 past the hour, and out of respect for the other side events, which are just about to start, I want to close it there. So thank you so much. I do apologize that we haven't had time for Q&A, as I'd promised. And that's, you know, I accept the blame for that one. I do apologize. But the session will be, you know, as I said, it has been recorded. All of those presentations and the contact details will be available on the Vienna NGO Committee website. So, you know, if there are specific things you were hoping to raise with one of our speakers, you know, feel free to do that afterwards as well. So just to say thank you so much to the UNODC Civil Society Unit for co-hosting this with us. Thank you for our speakers today. You've all been brilliant, and I really appreciate you taking the time. And also, obviously, thank you to Sarah for helping to coordinate this, to the translators as well for all of your support. And enjoy the rest of the day and the rest of the CND. I hope to see you at some other side events that are starting right now. So thank you very much, everyone.